Let's talk about REBOA, because in our trauma simulation, this would be something that we could most certainly do. And this marker is dying on me. So, does anybody know what REBOA stands for?
Resuscitative.
Okay, good.
Emergent.
How about resuscitative? Endo, inside the blood vessels. Endovascular. Balloon.
Oh.
Balloon.
Opening.
Occlusion
Aorta.
of the aorta. Okay. So, there are certain scenarios in trauma in which a patient has either a cardiac arrest within 10 to 15 minutes of arrival, whether they're a blunt or a penetrating trauma, and they lose pulses, which would then be an indication for us to proceed with a, quote, resuscitative thoracotomy, okay? Fastest way to a woman's heart is a left anterior lateral thoracotomy, in which you open the chest and then you cross clamp the aorta. But we have this amazing device called a REBOA, in which we can do that in a more minimally invasive way, if you will, than opening their chest. So if a patient comes in who's hemodynamically unstable, a good maneuver is placing a femoral arterial line, okay? So now I have this A line in the groin, which not only gives me advanced hemodynamic monitoring, but I have arterial access right off the bat. All of a sudden, this patient starts doing really crappy, crumps out on us. I can upsize this to a 7 French sheath that comes in the REBOA catheter, and then I can deploy the REBOA, okay? So this REBOA device is simply a little balloon on a wire, and then you inflate it, and there's 3 different zones that we talk about with the REBOA. Zone 1, Zone 2, and Zone 3, okay? So Zone 1 is the equivalent of us doing a thoracotomy, cross-clamping the aorta in the chest above the diaphragm. So there's vessels here, 1, 2, 3, and these guys. So what's the top one? Celiac trunk, SMA, IMA, and then you said? Okay. So Zone 2 is essentially like the no-fly zone. So we don't really want to blow up the balloon there. Here we're taking care of, like our lady there, we were suspecting a positive, fast, hemodynamically unstable patient that something's going on inside of the abdomen, right? Zone 3, we can blow up here. Which patient population do you think that one works well for? Not really. This I would want to get it up here if I did have a AAA. And I was going to go to these efforts to stop the bleeding.
Patients that have had like a colectomy, because that goes to that's the IMA.
No, again, here. So bad pelvic fractures or obstetric emergencies are good candidates for REBOA in Zone 3, because we're taking out essentially the iliacs here. That's what's bleeding in these scenarios. So in a bad pelvic fracture, you're getting bleeding from the iliacs, and in an obstetric emergency, that's where your feeders are coming in from as well, okay? So that, in a nutshell, is the resuscitative endovascular balloon occlusion of the aorta for a traumatic arrest in a way to try to get pulses back, to temporize somebody, to get them to the OR for definitive treatment of the trauma.